Dr. S.H. Lara had seen combat across 12 star systems. As Chief Medical Officer of the Galactic Coalition Forces, she prided herself on maintaining composure in any crisis. Her 4 eyes had witnessed limb regeneration, plasma burns, and dimensional tears in living tissue. Nothing prepared her for the human field hospital. The joint military operation on Kara's 7 had gone poorly. Coalition and human forces were pinned down by hostile artillery, taking heavy casualties. When S.H. Lara's medical frigate was destroyed, the human commander offered their field hospital as backup. She accepted, assuming human medicine would be primitive but adequate. The tent appeared normal from outside. Inside was a vision from her species' ancestral nightmare period. A human medic, Dr. Sarah Chen, stood over a soldier with his abdomen split open, hands literally inside the body cavity. Blood. So much blood. It covered her gloves, her apron, pooled on the floor. The human's vital organs were visible, moving, pulsing. 2 of S.H. Lara's junior medics collapsed immediately. "Welcome," Chen said cheerfully, not looking up. "Grab a station. We've got 15 critical coming in from the Ridge assault." S.H. Lara's translator had to be malfunctioning. You're performing surgery while he's conscious? Local anesthetic and a spinal block. Works great." Chen clamped something that made a wet squelching sound. "Can't waste general anesthesia in field conditions. Plus, Martinez here is tough. Aren't you, Marine?" "Ora, Doc," the soldier croaked, somehow still alive despite his organs being manually rearranged. A medic rushed past carrying a severed limb in a cooler. "Reattachment in Bay 3. Wait." S.H. Lara's voice pitched higher. "You're reattaching limbs? Without regeneration pods?" "Don't have fancy alien tech," Chen replied, beginning to suture. "We use microsurgery, pins, plates. Takes 12 hours, but Private Jackson will walk again." She paused. "Well, in 6 months after physical therapy." Another human burst in, uniform scorched, left arm hanging at an unnatural angle. "Doc, I dislocated my shoulder again. 3rd time this month, Stevens. Exam table 2. Chen didn't even glance up. "Someone pop it back in." A medic grabbed the arm and yanked. The crack echoed through the tent. Stevens screamed, then rotated his shoulder experimentally. "Thanks, document heading back out." "You're returning to combat?" S.H. Lara's medical training couldn't process this. "You need immobilization, cellular regeneration, trauma counseling." "I'm good." Stevens grabbed his rifle and jogged out. S.H. Lara watched in horror as another patient was brought in, conscious and screaming while medics irrigated a massive wound with saline. No stasis field. No pain nullifiers. Just chemical analgesics and what the humans called bedside manner. "How do your patients survive this butchery?" she whispered. Chen finally looked up, surprised. "Butchery? Doctor, we've got a 97% survival rate in field conditions." "What's yours?" 82%, with full regeneration technology." "Huh." Chen returned to her work. "We've been doing this since before we had germ theory. You learn to make do. Human bodies are ridiculously resilient if you know what you're doing. We can lose half our blood, survive without multiple organs, heal from injuries that would kill most species." She tied off the final suture. "Martinez, you're done. Bed rest for 6 hours, then light duty." The soldier sat up, looking down at his freshly stapled abdomen. "Thanks, document. You're an artist." S.H. Lara steadied herself against a supply crate. She'd thought humans were fragile deathworlders who'd gotten lucky. Now she understood, they were deathworlders who'd survived because nothing killed them easily enough, and they'd learned to save each other from everything else. "Dr. S.H. Lara?" Chen offered a blood-stained glove. Ready to scrub in? I'll teach you the human way. The alien doctor nodded weakly, reconsidering everything she knew about medicine and resilience.